And share. Let's make sure I'm sharing the right thing on my screen. What's going on here? 1 second. Oops, it's not what I'm looking for. Sorry.
I'll make you co-host and then you should be able to share too.
Oh, I got it. Yeah, just don't want to accidentally share the wrong window. That's always an embarrassing thing to do. All right, y'all, can you see my screen okay? My presentation stuff?
Yes, now we're good.
Sorry, I just saw Austin's profile picture for Zoom of the raccoon in the kayak and gonna be thrown off the whole day now. No, just kidding. Anyway, hi, I'm Molly Burns-Hansen. I'm the Community Engagement Coordinator at Move Minnesota. And today I'm going to be talking to you about transportation and healthy communities. So we are Move Minnesota. Move Minnesota leads the movement for an equitable and sustainable transportation system that puts people first. Our vision is to create a Move Minnesota where our transportation system breaks down barriers, protects our climate and environment, and creates access and choice. We connect people to transit where the system's working well and fight hard to ensure it works for everyone. We are passionate about connecting communities, ending the climate crisis, expanding access to jobs and resources, and improving daily life for Minnesotans of all ages, races, incomes, and abilities. So the agenda. We're going to be talking about the benefits of transit on for public and community health through talking about physical activity, community connection, increased access to essential needs, cleaner air, safer streets, and we'll talk over some opportunities to try something new. So transit, biking, walking, and rolling can make our families and communities much healthier. But getting more people on public transit starts with making sure everyone has access to great transit service and access to safe, welcoming streets for people. In fact, today, not everyone has that access, and current car-based transportation systems are putting health at risk. Health and well-being specifically for people of color, people with lower incomes, and people with disabilities who are disproportionately impacted. In fact, according to the Minnesota Pollution Control Agency, in Minnesota, while people of color and lower income tend to own fewer vehicles, do less driving, and use public transit more often than other groups, they are more often exposed to higher levels of traffic-related pollution. This is because of busy roadways and their associated air pollution, often run through communities of color and lower income. We all want our families and communities to be healthy, and we all need to get around. The good news is that when people do have easy access to great transit and safe pedestrian infrastructure, the benefits are really significant. So obviously, if you're like biking and walking or rolling to get places, that takes energy, you're getting exercise. But did you know that also happens when taking public transit? In fact, individuals who use public transportation get over 3 times the amount of physical activity per day of those who don't by walking to stops and final destinations. So approximately 19 minutes a day compared to 6 minutes a day. The U.S. Center for Disease Control recommends 22 minutes of moderate physical activity, such as brisk walking per day. So if you're doing like a nice little jog to your bus or train stop, that's getting your heart rate up. In fact, walking and rolling to and from bus and train stops is additional physical activity in your commute that you otherwise wouldn't get when taking a car. This concept is called active commuting. And those who actively commute are more likely to meet the 150 minutes of recommended physical activity per week for a healthier heart. According to the Center for Disease Control, low levels of physical activity are associated with $117 billion in healthcare costs every year. By walking and rolling to our transit stops, we can reduce the risks of heart disease, type 2 diabetes, and several types of cancers. So, community connection. We often think about transportation as how we get to an experience and get to our community. But we don't give enough credit to the fact that transportation is in and of itself an experience and a form of community connection, right? So gerontology, I always butcher this word. Gerontology experts have actually found that casual interactions with familiar faces, like those you'd see on your regular bus commute, can improve mental health and sense of belonging. Also, according to University of Minnesota Center for Transportation Studies researcher Yingling Fan, people tend to have happier commutes when they can take time to connect with others on their ride. Commuting through neighborhoods helps people better understand their neighborhood. When we travel via car, we typically use highways and expressways that let us go faster and just block out our surroundings and what we're being exposed to, right? But by taking transit, we weave through neighborhoods and better understand our connection to our community. And when accessible, transit is a lifeline for so many people and creates access to food, jobs, medical appointments, and other necessities that help us live our healthy lives. Public transit improves access to education and employment, which in turn leads to better long-term economic opportunities. In fact, 12% of transit riders are traveling to school and almost 60% are going to work. It also provides access to social and recreational activities, allowing individuals to participate in events they otherwise couldn't. Transit can be used by people of any age. It's a way for young people to start building their own routines and schedules even before they're old enough to get their license. I know for me, myself, when I started riding transit at the age of 12 from St. Louis Park, I got to really understand roads and how neighborhoods connected and how to like actually get around on my own. So by the time I was able to drive, I already knew all the streets. On the other side of the spectrum, transit can be used by older people to help them age in place, as opposed to having to move in with caregivers that can provide transportation. According to the Transportation Research Board, a survey of Americans aged 65 and older found that non-drivers take 15% fewer trips to the doctor, 59 fewer shopping trips and restaurant visits, and 65% fewer trips for social, family, and religious activities than those who have an individual vehicle. Public transportation is a way for non-drivers, particularly those with low income, or particularly low-income seniors and individuals with disabilities, to gain access to important services and activities that improve health, such as healthcare appointments, basic shopping, banking, education, and employment opportunities. So the term affordable transportation generally means that an individual's total travel expenses make up less than 20% of their household finances. In fact, car payments, gas prices, and parking can be a major budget drain, but public transportation lessens those financial burdens by alleviating the need to purchase and operate individual vehicles, which this fact always blows my mind. AAA estimated that in Minnesota, it can average around $10,000 a year to own a car when you add up all the parts, insurance, gas, all that. So public transportation lessens those financial burdens. And it also supports public health by leaving riders with more money for better living arrangements, healthier food, and medical services. Now, we're going to talk about clean air because rumor has it we all love breathing. So, the transportation sector in Minnesota actually accounts for more than 25% of the climate pollution in the state. And driving accounts for more than 50% of the air pollution in places like St. Paul. This is from the Minnesota Pollution Control Agency. In fact, the Minnesota Pollution Control Agency found that communities along I-94 have the highest rates of asthma in the state and have lower life expectancy rates than residents in other parts of Minnesota due to car pollution lowering air quality. These areas are also areas of increased poverty and are areas where people of color are overrepresented compared to the rest of the population. Alternatively, transit users produce half the pollution per mile of car drivers. So changing our transportation methods is what we need to do. While electric vehicles lower tailpipe emissions, and that's awesome, they still do reduce air quality because of deteriorating tires and brakes releasing harmful chemicals into the air. In fact, there are some locations right now where pollution from tires and brakes is starting to outweigh the pollution from tailpipes. So safer streets for everyone. Did you know 40,000 deaths per year are associated with car crashes? And car crashes are also one of the largest causes of death for people ages 1 to 44. By comparison, bus-related accidents have 1/20th of the passenger fatality rates of automobile vehicles. So as we continue reevaluating our transportation infrastructure in Minnesota, we need to examine how we make our streets safer for pedestrians, bikers, and transit users. We can uplift and encourage proposals of transit calming, sidewalk crossings, and designated bike and pedestrian trails. So we'll talk a little bit about an opportunity to try something new. Minnesota has a plethora of new transit and pedestrian routes coming in the next few years. So just, woo, look at all those connections. So how do we ensure we take advantage of these new resources for the betterment of our communities? Because frankly, it's unrealistic to expect someone to just immediately ditch their car and just change their whole life. So I'm going to talk about certain tips and tricks that help people make that adjustment to trying something new. First, try something fun that doesn't have a time constraint. Maybe you're attending like a party or going to hang out with a friend and you don't need a specific schedule of time to set to. This is great time to try something new, like riding the bus to the party or taking the train with your friend to a coffee shop. Associating a positive experience with your first transit ride makes it a more enjoyable time. Try it with a pro. Trying something new is always better when you have a guide. Asking an experienced friend to join you in this new adventure or to reach out to places like Move Minnesota is a great way to see if anyone's offering any trainings on sustainable transportation methods. Also, set reasonable goals. Making a sudden shift can be overwhelming, and it's good to be patient with yourself, take it one step at a time. Setting these reasonable goals helps encourage you to keep going, right? Because you accomplish one thing, the next step, the next step. So with that, I'm going to share what I've been doing over the past few years. I made a goal at the beginning of last year to make an effort in carpooling when transit is not accessible and taking transit whenever the commute was under 30 minutes. Now, after over a year, I carpool for about 90% of my car rides. I don't have a very consistent bus by my house, but I carpool for 90% of my rides and then take transit every other week. And I found myself walking to pretty much anywhere under a mile from me. Here's some stories from other people who have changed their trips. A St. Paul Public Schools parent actually told me it's more convenient for them and their student to take transit because they ride it together as they commute to work. They actually ride the train together and get to catch up, which I love to hear. Rich in Minneapolis said he rides the bus to save on gas and works 4 days a week at a fast food restaurant. The drivers are good and really nice. He gets to spend his time doing art on the bus, and it becomes a community connection. Georgette in Plymouth said bus drivers are careful and no accidents like when people drive a car. When you ask the bus driver, they'll show you with clear direction where to go to reach your connection. And Jenny from St. Paul said, I've practiced walking practical distances that I used to drive. It's an adjustment, but it's a good change. I think my bigger motivator is definitely the climate. I don't like the feeling of driving everywhere, and I don't like contributing what's already happening, and I'm trying to do my part. So the key takeaways are this. Changing your transportation method is beneficial for you and your community. Switching your trip increases your physical activity, community connection, and helps you get access to necessities for a healthy lifestyle. Using transit increases air quality and safety for everyone. And it's okay to be a beginner. Make a change, try something new. Don't be afraid to ask for help. There's never a bad question to ask. So with that, are there any questions? And I'll put up my contact info here. So yeah, we'll open the floor for any questions or discussion.
Yeah, I have a question.
Yeah.
This is Mary. Do you do a similar presentation for Greater Minnesota? I live in Bemidji, and I work in the northwest region of the state where it's just, people have to drive 2 hours or more to go to a doctor.
Mm-hmm.
So I'm just wondering if there's any work that you're doing for my area or for a similar area.
Yeah, so I can say that my work is specifically focused in St. Paul, but I will do like statewide education. In terms of, I know there are less bus routes up in Bemidji, and that makes things a lot longer. There are organizations that are working to discuss more about bike commuting. Bike Bike Minnesota is a great organization talking about that throughout the state. I myself am not currently working on work in Northwest Minnesota, but I'd be happy to follow up with more resources on that.
Okay, thank you.
Yeah. Any other questions, comments, or thoughts on how you'd want to think about transportation in terms of public health?
So this is Erica, and so you're the community engagement coordinator.
Yeah.
Can you talk some about how you engage different populations in different communities?
Yeah. So, I will say I have a background in disability studies, so it's been very like ingrained in me that if someone's not at the table, like you can't really be having the discussions about how to support them, right? There's a phrase that I really love of nothing about us without us. So with the work I do, I spend a lot of my time trying to meet people who are trying to achieve certain goals in their community and see if there are ways we can support them. For example, last summer I met with some members of a community garden group in Frogtown, St. Paul, and we found a way to do a little transportation fair to like make learning this stuff more family fun because it's a very heavily child populated area, and making it accessible and free. We also have previously done projects that are centered on places like North Minneapolis, where we've worked with community leaders to find ways to talk about transportation and like what are barriers to folks trying something new and what makes them feel confident and empowered. I'm trying to think of other recent projects. I I do also spend a lot of my time talking to community organizations, like specifically neighborhood groups. So I'm talking to the residents of certain areas to talk about what their needs are. And I try to tailor what is presented to the group I'm meeting with.
Just to follow up, I have two follow-ups. What are some of the needs that the residents are bringing up?
Yeah, that's a great question. So often there are concerns about um safety, and we usually have discussions of like what is an unsafe situation versus what is an uncomfortable situation. I've done a lot of work with youth who are still learning like how to process these emotions, right? So we talk a lot about for example, if something's on the train that's making you uncomfortable and you're not sure like, is this dangerous or do I feel uneasy? Um, it's good to just like go and sit by the bus driver, have like the door opening and closing more often with fresh air and just like help you ground yourself, right? Um, Other examples would be bringing out the residential transit pass, and talking about that, which is a program where property owners of multi-unit buildings can actually bring unlimited ride transit passes to their tenants. So it'd be like a $14 unlimited ride pass per unit per month. So I've tried working with like uh, residents of those areas to bring it to their property owner to get that implemented. That's been harder. We also do work regarding promoting another resource is something called Guaranteed Ride Home, which is a program through Metro Transit where if you commute without a car at least 3 times per week, you are eligible for like an emergency ride share. And what that means is like, let's say you take the bus to your job and it's, 2 hours away. And then you find out your kid's sick and you got to go home, but your bus isn't coming for 6 hours. You can call an Uber, Lyft, taxi, what have you, and Metro Transit would reimburse that up to $100 per year. So it's a lot of like bringing out these programs that are under discussed and under advertised in certain communities and making sure people know about resources. We also do make maps of like how to connect like like bike share or scooter share spots and like how you can take that to a transit ride, take the transit ride, come back, get the scooter to get back home, and things like that.
Thanks. that was one of the comments that Jaime had put in, which you answered, is how do you work with communities who do not feel safe walking in their community? That's similar, but do you have anything to add to that?
Yeah, so I think that is something that everyone is kind of struggling with right now. I think since the pandemic, we've seen a rise in antisocial behavior, and also inequities in our society have just become really amplified, right? So we do talk about things like wearing what you call it, colors that can be like seen more easily with lights, being mindful of where you are. If you're listening to music, keeping that at a low volume so you can hear others and hear what's around you. And, keeping in touch with people to say, like, hey, mom, dad, I'm going to the store. Like, I'll be back in 20 minutes. And, kind of checking in with people. I know some people like to do share my location features through Apple and other tech devices. That's what I'm looking for, just to help people keep tabs. So those are some of my tips. It is obviously different for every situation and every location. But yeah, that is part of my advice. Yeah. Any other questions or comments?
This is
Maybe I'll
Connie.
chime in.
I am up in Bemidji as well, and working with Headwaters Regional Development Corporation. They have hired a transportation person. They also connect to, to getting people to move outside of using transportation. But the issue in the rural area is that there isn't anything after 5 o'clock.
Yeah.
And people walking after 5 o'clock in Bemidji is not safe. Even the things you discussed, I wouldn't walk alone. I would have somebody with me. So it's just this is something that comes up all the time. I used to work and live in Minneapolis for 20 years, and then to come to Bemidji to do the work and see the differences and the lack of issues being faced or addressed in the rural areas is really frustrating, because there's no options. There's no transit. The transit's done at 5 o'clock. We have a big hospital here, and the patients go into the ER maybe with emergency transportation and they go home, or they come on the bus at 5 o'clock and they need to go home at 7. There's nothing to take them home, and it's not safe to walk. Those are just issues that I think maybe are a little more unique to the rural area, and I'd like to see a little more work done in rural areas to explore that. And that's why I'm really grateful that Headwaters Regional Development Corporation is working on a plan for that, and actually hiring some of the folks that are living in a low-income neighborhood to be trained to be transit drivers so they can expand the hours. There's some really creative ideas happening here. And it would be good to connect, because some of it too addresses the idea of being more physically active. People are nervous to get out and walk, and they don't have another option, or ride a bike. We do have, bikes here now that people can ride. But a lot of the people who would want to use them may not be able to afford them if they have to put the tokens in or whatever. And so they're stealing bikes to get around. And that's very common here. Very, very common. They steal the bike, get to where they're going to go and drop it. So it's very common here. And actually I was really surprised with the level of that in Bemidji. And, I think that since I've been here, it's been almost 10 years, I've not seen a change in transportation. I have seen some wonderful walking programs. When I was in Minneapolis, I worked at Native American Community Clinic, and I worked with Southside Clinic. We had a program called Step to It Southside, and we had walking groups and things like that that encouraged movement. Bemidji does a lot of similar things like that, we could certainly use more of that. But just thinking creatively about how you get people involved in helping to expand transit, because there's not enough money directed into the rural areas for transportation. We're always last on the list when it comes to getting a new bus or working with the Department of Transportation. So HRDC has done some work in trying to get some funding moved into the rural area, which is a constant frustration of mine. I work in community health, and trying to see the grants for community health going into the metro area rather than the rural area. So that's just something I wanted to address, because I do see some nice changes, work being done in Bemidji, and it's just feels like it's just a beginning. And connecting it to, movement and exercise is really great if you have that option. Here it's a little bit tougher, and the winters are rough. This winter hasn't been so rough, but the winters are rough to get around in. So
Totally.
yeah. Thank you.
Well, thank you for sharing, Connie. And if you want, I'd be happy to talk a little more over email. Because like I said, a lot of my work is focused in St. Paul, but I would be happy to connect you with people who are either doing work to expand transit routes in more rural areas. I think it's one of those moments where all the names blank from me, but I would be happy to talk and, figure out how we can get y'all the supports and contacts you need. I'd be happy to talk more offline.
Okay.
Wonderful.
I have your email, so I could send you mine.
Sounds good. Yeah.
Okay. Thank you.
Yeah. I also, something I will mention just while we're talking about like resources, I think I did mention Bike MN as a resource for bikes. I think they might do affordability programs. I'm not sure. But there is also starting, I think it's July of this year, there's going to be an electric bike rebate in the state of Minnesota, and that's up to $1,500. So that can be really great. I am not an expert on it, but it is worth looking into. Awesome. Any other thoughts, questions, comments?
Molly, would you be willing to stop sharing your screen so that
Oh yeah.
anybody wants to turn their camera on could do that? And then there's one more question. Well, first I want to address that, Connie. That was a great question. And I think people in the metro area don't always think about how different the issues are in rural Minnesota, greater Minnesota, especially with the transportation issues, and don't think about, you have these large geographic spaces that people need to move between, and how do you do that? And then the same issues that we have in Minneapolis County are the same ones you were talking about having in Bemidji with not feeling safe at certain times going out, and the bike stealing. So I really appreciate you saying that.
People do need to get around. We just have to figure out how to do more of it efficiently. That includes exercise and actual transportation that's affordable. Yeah.
Out of curiosity, I know this is a much newer program, but are y'all familiar with Our Car?
I think HRDC is exploring that.
Okay, fabulous. 'Cause they're working to expand, but it is essentially like a car share for electric vehicles.
Yep.
And it sorry, it's a you can pay like, I think it's sometimes like as little as $6 an hour to use a car and then bring it back to a station. And obviously, if it's not safe to walk, it's not safe to go to the station, but
Right.
yeah. Awesome.
There's a question in the chat. I've noticed that the streetlights in our neighborhoods is a privilege. Any discussion about promoting better lighting to improve safety? And then Mary Mitchell responded, there's no evidence that streetlights can prevent crime. Then somebody said, according to what? Mary said, according to what I've read. So do you have any comments about streetlights?
Yeah, I will say that in my experience working with neighborhoods, that streetlights have made people feel safer. It has made people feel more secure and more confident, and has deterred some degree of unwanted behavior. That's from what I have heard from people. I know that it's been an issue about having them consistently around, and then there's also been an increase of like people taking copper from them, which is unfortunate and stressful. I would say that there are organizations that are working on advocacy to improve streetlights. Move Minnesota is I don't work in the advocacy department, but we do work regarding making safer streets and more improved ones. So if that's something people are interested in, you are welcome to like send me an email and I can connect you with the right people.
And then Mary, do you have any response to what you put up that you saw something that said streetlights don't prevent crime?
So it would help to unmute. Um, no, I've read, I've read different things, you can find different information, but and it may help. There may be some crimes that are deterred with lighting, but and I'm sure it does make people feel safer, having the light. And it's, what it might help too is it might help people navigate better.
Yeah.
Because if you can't really see the sidewalk and you have, sidewalks that aren't level, that's a hazard. And so that's where I can see that they would be a benefit. But it's my personal bias too, because I don't like streetlights myself. But I do understand the need for streetlights in some areas. And then I kind of wonder also, what about small little solar type lights, that light up sidewalks and light up pathways? But yeah.
Yeah, I saw an interesting graphic the other day about light pollution in streetlights and how like certain designs are safer for the environment, but still give people the safety they need. And it was it's like a mushroom shaped light that will only point downward.
Right.
Yeah. So it's tricky because I mean, how do humans and nocturnal animals coexist?
Yeah, right. Yeah, and insects and birds and all that stuff too. But yeah, I mean, I think it probably does, they probably do have some benefits, but overall, maybe not as much as we would think.
Yeah.
Have you done any work with sidewalks too? In the
Those
cities,
are
we have sidewalks, and I know there some local public health agencies are working to get more sidewalks put in.
Yeah, sidewalks are something I'm personally very passionate about. I actually been part of like a nationwide work group just to talk about how to get sidewalks better, just to like vent a little bit. So Move Minnesota does advocacy work, not that I'm a part of, involving like talking about how streets are safer when we have wider sidewalks that can fit more people, that along with there's more safety if like bikers aren't in the road sharing lanes with cars, but instead have like a designated part of a sidewalk to walk along, barriers and stuff like that. But yeah, I will say that with sidewalks, a big concern of mine is how uneven they are and how they are not reliably patched and fixed. That makes them inaccessible for people with mobility devices, people with strollers. And I know something I would like to see, this is my personal opinion, is I'd like to see better investment in like sidewalk repair as an accessibility need and for a community need to make sure people aren't stuck inside.
Austin, you want to ask your question?
Yeah, sure. So, something I've seen working, studying in public health is that like discussions about transportation are often limited to like safety features in cars, like seatbelts, which is good. It's good that people wear seatbelts. But with the presentation talking about all these other connections between transportation and health, especially the primacy of cars in our transportation system in the United States. I was wondering how you thought people in public health should work and use their position and knowledge to support creating more transportation alternatives like transits in their communities?
Yeah, that's a great question. I think something I something I've seen a lot is I cited them a lot is the Minnesota Pollution Control Agency, right? And how much of asthma rates are correlating with car usage. And specifically that even with electric cars lowering tailpipe emissions, the tires and brakes, as they wear out, they release chemicals, and that still contributes to asthma. So as someone with asthma myself, I often think of it through that lens. My colleague ran a project in North Minneapolis along I-94 from 2019 to 2022 about how a more frequent something called a bus rapid transit, which is a route that comes every 15 minutes. It's level with sidewalks, so it's easier for people to roll on. And it's a bus that you pay for before getting on to save time. How having that come through parts of North Minneapolis with high asthma rates and having people take that more did help like reduce rates of pollution. It's still very high because of I-94, but it is a way to mitigate increases of asthma and air pollution. So that is something I think people should talk about a lot when it comes to public health, and like how it navigates with transportation, is that reducing our car usage reduces the air pollutants in the air. Also, like I mentioned, obviously talking about exercise and increasing that. I think it's kind of an underrated thing that like walking half a block 4 times a day adds up to like a bit of a little bit of a walk, a little bit of exercise, right? And that does, get you moving more than you would with your car. I think also, like I said, with the background in disability studies, I think about it a lot for aging in place. I think I've seen studies before that show that it's more common for people to, as they age, leave their homes and move in with family to be taken care of when they are in areas that are like not super frequent transit, right? Or if they don't know how to use transit like earlier on before they may lose their ability to take a car. So that's something that I like to see, is just talking about it as like a resource, something reliable. It also increases accessibility for people who may not be able to drive due to low vision, sometimes conditions like epilepsy or narcolepsy that make it harder to operate a vehicle reliably. So this is a great question, and there's like so many answers. So I think the number one that I'd talk about is asthma. Just going back to that. Also, as climate change comes about, right? If we're seeing that cars contribute a lot to climate change and we're seeing that getting worse, that's going to make air quality worse. So, in short, talking about air quality, I think is a best way to use the position, is the connections there. And yeah, I see Julia's comment in the chat that partnering with transit agencies is always great. And, Move Minnesota, we're always down to partner for things.
Has there been any discussion or looking at how the weather plays a role? And I'm talking in particular extreme cold, lots of snow. I mean, one of the issues I encounter in work, I work a lot with the homeless, is just getting from one shelter to the other is extremely difficult if you're in a wheelchair or have a mobility issue. The sidewalks aren't shoveled, and especially at the ends. They used to have a program called Sentence to Serve where they were doing that, and they don't do that anymore. So there's really no one other than maybe somebody who lives up the street or down the street that's kind enough to do it. They really don't have any funds to pay someone to do that. There's not enough city workers to cover that particular cost. maybe this would be an exercise thing that we tell people, go shovel, get your exercise in, move Minnesota, just tongue in cheek. But I'm just, those are real concrete things that we face in the winter, all of us here in Minnesota. And I'm just wondering how it's different when you're just talking in general terms about transportation, and in where there is no obstacle like snow or 30 below weather, which is of course going to deter people a lot. But the snow is one thing that I wish we could do a better job somehow in cities or counties of finding a way to clear the sidewalks, at least to help those folks who have difficulty getting around. But there just doesn't seem to be anything. I don't even know if there's any kind of funds that would be appropriate for that, to look for like a grant or something that would be ongoing actually. But
Yeah, I'll say, speaking of, it's starting to snow outside my window. I'll say that Minneapolis did recently approve a pilot for municipal sidewalk shoveling. But then the pilot's supposed to be over this year where there hasn't been much snow. So I'm not sure how that's going, obviously, but the idea is that would be opportunities for like younger people to start jobs with shoveling. It's a little more controlled than the usual like knocking on your neighbor's door being like, hey, I'll shovel for $10. You have that reliable income. So that also is being worked on in Chicago. And there are a few other places in the Midwest that do get snow, maybe not as much as Minnesota, but have been working on municipal pilots, and finding that by what is it? Losing my train of thought on that one. It's very interesting to read about different funding methods. There are grants. There is sometimes like use of public taxes, like small amounts, to cover that. But it is like a kind of innovative concept right now.
mm-hmm.
Yeah, I see Austin's comment about transit to be helpful in a few ways in the winter. No need to shovel a car out of the snow or clear a parking lot or wait for a car to warm up. And rails much less susceptible to ice than cars or buses. Yeah. Something I think about, like when I think I shared the statistic that death due to car crash is like very common, especially for people under 44. But something my mother raised me with is that like take the bus when the roads are bad because it's so heavy. It's someone who knows how to maneuver that mode of transportation more, right? It's more reliable and has a better view of things, right? So I'm with you, Austin, that in the winter it can feel like it's safer to take sometimes.
So this is sort of an out there question, but like, do you ever do like mock situations on how to ride a bus? Because I found that some people I've talked to, young people that didn't grow up around buses, they're nervous to do it because they don't know how to buy a ticket, use the bus, how to get on the bus, different things like that.
Yeah, so we do that. Excuse me, I myself right now, I think I mentioned I've been working a lot with youth over as of late with teaching them how to ride transit. There was that national bus driver shortage for school buses, and so a lot of schools switched to relying on public transit, and then the students didn't know how to do it, and it was a whole chaotic jumble of chaos. So yeah, so we do teach people how to do it. There are videos online, but like I said, learning from a pro is always great. With learning how to ride, learning how to transfer. I just did a month-long intensive with some high schoolers about how to ride the bus, how to transfer from bus to train, how to plan a trip. And by the end of the class, they just said like, hey, can we prove what we learned and actually plan our field trip? And I was like, sure, let's do it. And we went to the mall and it was great. There's also something that one of my colleagues came up with called a bus march, where as a group, you practice going up to the bus, practicing paying, get onto the bus, and then go out the back door. Just like practice the sensation without leaving your comfort zone yet. And that's like a nice little warm up. So yeah, mock bus trips are great. Sometimes they're real ones. Unfortunately, like our transit systems are so stressed out and strapped that we can't like have a bus come out to a place for a little tour, right? But there are resources, and it's one of my favorite things to do is teach people how to ride transit, because it's just like I love seeing people learn that skill. It's great.
I would think that would be a thing for seniors too. You know,
Yeah.
adolescents, seniors have a lot in common sometimes.
Yeah, yeah. I haven't been given the opportunity to work with seniors on it, but I would love to. Yeah, I would
You
love
could
that.
partner with Julia Wolf.
Hey,
You know,
Julia.
I was just gonna say, hit me up. We should probably meet, not in the next month, but we should probably meet. I will drop my email address in the chat.
Yeah, I will put mine in the chat as well. Oops. And then I see I'm sorry if it's Jamie or Jaime, reading some of those bus schedules seems daunting. Yeah, so here's my tip. I think reading a bus schedule can be a little overwhelming. I really like to use Google Maps for planning transit trips. And the reason why is because it does have a GPS feature. So it'll tell you a play-by-play of walk 500 feet and take a right when you see Arby's, and that will be your bus stop. And then if you get lost doing that, it'll show you on the map how close you are. You can also use like the little street view feature to see what your bus stop looks like. Before smartphones were a thing, I used to go on my computer before like big lengthy trips and like take photos on a little flip phone of what the bus stop would look like. Um, yeah, I see Allegra also likes using Google Maps for bus routes. It's helpful because it'll also show you different options. It'll say like, hey, you could actually like on the end of your street, get this little scooter and take it to this bus. And that would cut your time, stuff like that. It's also really nice because you can share like your route with people. So if you have concerns of being out on your own, you can have someone like see how soon you'll be there and when to expect you. So yeah, I'm with you. Bus schedules seem daunting. I highly recommend using Google Maps for planning trips. There's also the Metro Transit app. It does not have the GPS feature, so that's a difference. There's also an app called Transit, which I personally get a little overwhelmed by. But some people really like it, where it just tells you like the next bus coming towards you and when it'll be there. There's also something called Next Trip, which is when you're at a bus stop or station, there'll be like a little sign that says text 5, I think it's 59470. Don't quote me on that. I might be butchering the phone number, but there's a sign that says text this number with this code 50934. Thank you, Diane. 50934. Thank you.
I use that pretty frequently at my
Yeah.
bus stops, and it works really well too to
Yeah.
tell you
It's
what
awesome.
name number letter combination of the bus is coming,
Yeah.
what time, and yeah. Anyways, not to interrupt.
Oh, yeah, that's super helpful. And I see that Julia mentioned that it can be hard for older seniors. I'd say something that's wonderful is Metro Transit does have a trip planning customer service line. So before you leave, they can help you plan a trip and talk you through it. There are also bus maps that are available. Yeah, it's really awesome. I know there's been like shortages of staffing for like everything customer service related for a while. So I'm not sure how like easy it is to do, but that is a feature. It's also great to like I said, Move Minnesota is here to help y'all out with planning things, especially in the St. Paul area. There are also for other parts of this metro, there's something called transportation management organizations, and they're there to help you like figure out ways to get around that lower your lower emissions into the environment. So, yeah. Any other thoughts, questions, concerns? Great, cool. Yeah. Please reach out to me about anything as it comes up. Would love to chat more about this, would love to connect with resources. If you like, if it's like 3 a.m., you're like, oh my gosh, I forgot to ask Molly about a resource for Minnesota Valley Transit Authority or something like that, just like feel free to email me. I'll do my best to get you connected to the right folks for the right things.